I request Professor Dr. Sandeep Kadu sir to guide us about how to prevent from any medical legal issues during medical practice.
Already Dr. Vijay Patil sir and Dr. Shivananda Parke sir has taken their sessions. I am only going to touch the important topics and important things which are very helpful, and it's not given in any book. It's the experiential learning. So the first and foremost, everyone wants as a successful practitioner or successful doctor, or there are many staff nurses, same thing. The first and foremost, I am very against the word of the profession. Actually, we say that is the health professional, but we should label it as a service. So each profession has the important thing is that it is only oriented for the profit, but service is never oriented for the profit. So it should get inculcated in the mind of the doctors, nurses, that we are for the giving service. So in service, it is not oriented to the profit. So remember this, that society gives us respect of the God, and we are next to the God. This one sentence, if you remember throughout your life, whenever the dilemma comes, whenever you get some pressure from the authorities or from the politician, so you should be firm in your mind or with your principles. So before starting, so I want to show what you makes a doctor. Whatever in video, the characteristic like empathy, sacrifice, patience, all should be there. And it's not the only theoretical part. if you keep in mind that I have to I have to do my practice ethically. There are some hurdles, there are some difficulties, but it's not like that it's the impossible. It is possible, but slightly difficult. So, do your practice ethically. The curse of today's medical profession is the CUT, that is cut, dichotomy. What is dichotomy? Button. What is dichotomy? That is the fee splitting. Means the 1000 fees taken from the patient, 300 will go to the referring doctor. That is the curse for the today's profession. And I am not telling theoretically. I have done my sonography practice for 10 years, and with God's blessings, no second allegation came to me, or that you have missed cleft palate, or you have missed any small finger is not there, or small things. In 10 years, I used to do the sonography at a rural area, that is the Nevasa, that is the Taluka place. But if you give the time to do 15 minutes to do the UHG, then you will never miss. So you should have the patience. And in that 10 years, I have not given a single paisa as a cut. But still, 10 years successfully, I have completed my practice. And those doctors used to they send the patient to others, but if their father, mother, wife, they refer to me for the sonography, and the patients for the cut, they refer. So the budding doctors, budding radiologists, budding pediatricians, budding physicians, there will be the difficulty, but if you are firm on your ethics, you will get what is our dream: Gadi, bungalow, and this one, some amount of the bank balance. It will definitely going to come if you have the patient, and you will get a nice sleep at the night. So do your practice ethically, and it's not difficult. It's not impossible, slightly difficult. Understood? So whatever happens, if you do unethically, you will get the money within 1 or 2 years, and a single incident will occur, and that will vanish all what you have earned, the money, faith, fame, all will go in vain. There are not, since the Warren madam is there, these people, Naikwade sir is there, these people had spent their, our dean sir is there, these people had done their practice ethically. So it's not impossible, it's slightly difficult. If you do that, you will be successful, you will have a good health, wealth, all these things, but it will require, some will get within 5 years, you will get it within 10 years, but whatever the patient that will be the constant thing throughout your practice life. Otherwise what happens, 1-2 years, the peak is there, and then it goes down, and it will remain like that. So follow that. Be skillful in art of healing, not the killing. It is again related to those who are radiologists, gynecologists, or even any general practitioner. As if today's everyone follow whatever the time I have spent here, it will be the fruitful, that no one should refer the patient for the sex determination throughout your practice, even if it is nurse, even if it is the general medical practitioner or physician. So why? Because according to me, it is the murder. Because that fetus has not taken this one, or not seen the world, and only the sex has been determined, and it is of a female, they do the abortion. So what is this? It's like a murder. And for the murder, the Don people do, there is some rivalry, but here nothing. She is only the female, and only for that you are doing the sex determination. And again, the thing here, you go to the root cause. What is the root cause? only for the money purpose. They offer you 50,000, 1 lakh rupees, and you say that within 2 minutes you will get 1 lakh rupees, 50,000, and for the money purpose. So my friends, Birla, Ambani, all these have the much more in crores bank balance, but they also eat chapati and whatever the sabji. They don't eat the sona or the gold. So remember that. Or we, whatever we wear, so it is about 2,000 shirt. They will wear the branded 10,000, whatever the hire moti on there. That's not the thing. But we should be happy, whatever, and we should respect ourselves. That I am not doing any illegal things. So all my students, throughout your life, if there is any pressure, politicians' pressure, or any your colleagues' pressure, I'm not going to take one of my best friend. He also reported that he had two girls, and the third time her wife was pregnant, and he said that you have to do for me. But I said I'm not going to do. So 1 year he was not speaking with me, this one, but afterwards he said that, no, you are right. So our intention should be the honest one. So be empathetic with your patient. So how you should be empathetic with the patient? I am also giving the practical tips of each. How you should be empathetic. Suppose, now I also, the Honorable Duty sir has told that 3 years I have done the casualty duty. I am going to this one. So I know what happens in the casualty duties. Why I have done? Because used to get 300 rupees per night. I used to do as a 9 to 5 as a tutor, and in night 9 to up to 7 a.m. Also Patil sir also knows that as a night duty. And in the casualty, what happens, there is one word is that batting kar do. So what is batting? Though if the patient comes, tell them कि अभी यहाँ होता नहीं, ICU बेड नहीं, ये नहीं, डॉक्टर नहीं, और उसको सिविल में भेज दो, और हम लोनी में से नाशिक में भेज दो, नगर में भेज दो, like that batting. So if think that it's you and you come with your father, mother, and someone does to you like this, there is bed, but he is telling lie, bat kar do, because you are in a party. There was a Tarang hotel was there, and many residents were there for the party. They used to tell me, sir हम पार्टी को जा रहे हैं, वो बैट करो. मैं बोला नहीं, मैं आपको वहाँ से बुलाने वाला. Like that. So don't do that one. Only for our small happiness. So those who are, that's why I am telling More sir, you should be cautious. Take a register how many patients come and how many bat. So and report to Duty sir. So he will do the chabi. So in our institute, it should not happen. The batting by any resident. So if it happens with your father, mother, are you going to this one? So how you should be empathetic? Think any elderly patient come, treat him as your father, mother, if engaged as brother, sister. Are you going to do this with your father and mother? If your answer is no, treat that patient. Are you going to this one suggest the investigation of the MRI? You know that no need of the MRI, but still again for the cut 2,000 rupees, 500 rupees will come to us. We refer to the MRI. So is it needed really MRI? Is it needed CT scan? Because one CT scan is equal to 1,000 X-ray exposure. So only for 500 rupees, are you going to expose our father, mother, brother, sister for that exposure? If your answer is no, don't send that patient for the CT scan or unnecessary investigation. So be empathetic, and I have given the practical key. How should you be empathetic with your patient? Then don't compromise with your illegal things. Same thing. If I compromise once for the sex determination, I have done like my one of the best friends said that they do, and for his friendship I have done the illegal things. Then there are many things. So I have to do again because someone is there. Doctor पहले किया था ना, अभी तो आप हरिश्चंद्र बन रहे हो. So you have to do that illegal practice throughout your life. So don't compromise. And when your personality comes to the society, no, he listens nobody like that. So make your personality like that. They should think 10 times before asking any illegal things to you. So and it's again I'm saying it's not impossible, it's difficult. Remember Newton's law, everything that every action has equal and opposite reaction. If you will do good things will happen to you. If you will bad things, one day you have to face that. And the real that I have told that throughout my life I have done the struggle and I got what I want. So, but you should have the patience. I already told that the casualty is the nose of any hospital. So see this video, and it should not happen at any hospital.
सुसाइड केस है, जहर खाया है, वो इधर कहीं को पड़े है, अंदर लेके जाना। वो क्या उसकी माँ फॉर्म भर रही है ना उधर?
जल्दी कीजिए ना।
सुन डॉक्टर, वो बेचारा मर रहा है, कुछ करना।
सॉरी, उसे कैजुअल्टी में ले जाइए। आई एम ऑफ ड्यूटी ना।
ऑफ ड्यूटी बोले तो? जहर खाया है, तुम्हारे सामने मरा है, तो ऑफ ड्यूटी बोले तो?
देखिए, इट्स अ केस ऑफ अटेम्प्टेड सुसाइड। पहले पुलिस फाइल बनवाना पड़ेगा।
अभी तेरा अटेम्प्टेड मर्डर किया तो तेरा ये हॉस्पिटल तेरे को बचाएगा या पुलिस डिबेट करेगा? बोल! क्या लिखा? आप प्लीज समझाइए।
Both are extremes. I am not this one what Sanjay Dutt is doing. It's also wrong. But the mob psychology in the casualty, because I have experienced many times in the Loni. So if there is mob psychology and if you are not polite, don't have the good communication skills, all these things has happened to many doctors. And you also read in newspaper that these things has happened. So when in a casualty, because all are in a panic conditions in a casualty, they want a treatment. All these medical legal formalities you can also do afterwards. There is Supreme Court verdict also that the first give the preference to the treatment and afterwards you can do all the medical legal formalities. So that should be inculcated in the mind of all the casualty medical officer. Usually now you keep the JRs there. So all the JRs, so also in writing, More sir, you give the notice to all this one that the first give like SOP, the treatment, afterwards medical legal cases, after medical legal, if it is admitted, what are the things, you also take the help of Dr. Vijay Patil sir, and if the death happens, so what to do? So all these SOPs must be there and circulate to all the residents, take the HOD signature, take the signature of this, they should know all whatever the 150 residents are there, that they have read that, and if they have done anything, they will be responsible. So let the responsibility to them, you don't take the vicarious responsibility on you. So MLC cases, what is the MLC cases? It is the, Patil sir must have told it, it is the medical case having legal implication for the attending doctor, where attending doctor, after eliciting what history and examination, thinks some investigation of the law enforcement agency is needed. Means if you have any suspicion, there is sixth sense of every doctor. If you think something is wrong in that, though patient is giving wrong history, patient is telling lie, or in examination you see some injuries or whatever the things are there, if suspicion is there, you do the MLC. Again, the MLC not the FIR. Compressor also knows MLC is not the FIR. It's only you are telling or giving the information to the police like this has, and it's the police job to do the further investigation. So don't hesitate to do the MLC. Is it clear? So what are the different medical legal cases? All know the trauma patients. So each trauma patient is the medical legal cases. Even the patient gives the history that the fall in bathroom is there. So it is like accident. You do the MLC, let the police do the investigation. If it is really fall in bathroom, nothing will be there in further. So why you are hesitating to do that? So then the many residents write CLW. But when they come to the court and the lawyer asks them, what is the long form of the CLW? They are not able to tell the long form of the CLW. That middle, what is the CLW? You. Confused? Lacerated wound, yes. Very good. What's your name? And you are from which department?
No, sir, I am working in Shirdi.
In
I am pediatrician. I work in Shirdi.
Oh, okay. So many doesn't know and they write the CLW. So you only, sir, or you can say to Patil sir also, so whatever the injury certificates given by this one, so don't use these short forms. They have to use the long forms, the contused lacerated wound. So they not able to give the full form of the CLW. So his sir has already told that it is the contused lacerated wound. But don't use the short forms. Then grievous hurt. There are only 8, I am not going to in detail, there is only 8 things or 8 situations are there which you have to label as a grievous hurt or as per 320 IPC. Otherwise, all are the simple injury. Why it's important? Because if you have written grievous hurt and that it's not grievous hurt, that the person accused can go under the bar for up to the life imprisonment in a grievous hurt. So it's on your report. How you are, and in court you have to again give the defense under 8 clauses, which clause fits when you label it as a grievous hurt. So be careful when you are giving the injury report that and writing that is the grievous hurt. You should have that evidence and you should be confident if that case goes to the court to defend that it is really the grievous hurt. So I know Parke sir, Patil sir or Kamble sir have inculcated in the minds of all the students how you have to differentiate it as a simple and grievous hurt. Also on my YouTube channel there is the only 25 minutes video is there how to differentiate is the grievous hurt and the simple hurt. Then poisoning cases you all know. Then you have to preserve all the samples at a casualty. Broad dead case. Broad dead case again you don't know anything. So you have to inform to the police. And there is one misconception in the mind of all the doctors. We take the onus that the medico-legal postmortem should be done. No. Your concept should get clear that after the death, when you do the medico-legal case, the owner of the dead body is not we. It is of the under 174 CRPC, it is the police. So, the all rights given to the police that they has to examine if they think it is the natural thing, they can hand over that body to the relative. And the decision making is not we. Decision making is a police. So in casualty many times any relative doesn't want to do the postmortem examination. So they will fight with you. Doctor, it's like a MI and in front of us the patient had a chest pain and the previous history was like that. He was under the treatment of any kind. They will tell. But you have not seen that patient. It's the first time you are seeing. So you don't have to take. So you have to politely tell to the relatives that it's the formality that I have handed it, told to the, done it is the medical legal case and it's on the police. If the police gives dead body to you, we don't have any objection. So don't take onus on you. So let them fight with the police. Understood? So this misconception is there. We are the authority who are deciding that the medical legal postmortem is done or not. No, it's the police will decide. So that that one thing you should get, and your concept must be clear about the 174 CRPC and who is the owner of the dead body after the medical legal case. Then sexual assault cases are also come as naturally as a medical legal case. Then it's very important to interns, JR, SR and all the lecturers. So what? Best defense of the doctor, anything, because we are trying from our 100%, from our, any doctor doesn't want that his patient or give some any drug and the patient should die. No doctor wants that. And we give our 100%, but still some mishaps occurs. So to define it, that our paperwork should be the perfect. So best defense of the doctor, that you should have a good proper paperwork. Proper daily notes should be readable, and we all, there are WhatsApp jokes, even Supreme Court has also that the doctor's handwriting on a commented. So our handwriting must be illegible and readable. Then date, time should be mentioned in each note. We forget that date, time, when you have seen, if you have visited the patient 3 times, then your date is very important for the critical patients. Then advice in investigation should be underlined, and do the signature after writing the notes. Better make rubber stamp of your full name, not initial, with registration number, your designation, that is JR, SR, lecturer, etc. So each time, because you have less time, you have to write, or this resident has to see 50 or 100 patients. So better to have your stamp and you do the signature. Understood? And in that stamp, your full name, your registration number and your designation must be there. And the consent. For the consent, again, the consent is the best defense when in a negligence case. If you have taken the proper consent, then you are in a better position to defend in a court. No consent is the crime. So, Sagar, what is the definition of the injury?
Any harm done to body, mind, property and reputation of the individual.
Yes, he is correct or wrong?
Any harm done illegally to the
Yes, you forgotten very important word. Parke sir told you. That illegal word is very important. Why? Because as a surgeon, we take the incision. Again, you are doing the harm, but it's not. It's we have taken the consent before doing the operation. So what is the definition under the 44 IPC? I also tried. I have not read the books since 2 years. And when I was revising yesterday, so really I also know any harm whatsoever illegally caused to a person's body, mind, reputation, property. So I also tried on ki माझी पण definition apart आहे की नाही आहे अजून. Yes. So illegal word is very important. So any harm whatsoever caused the illegally to the body, mind, reputation and property is termed as a injury. If it is legal, means the before operation we take the consent, is the legal one. It's not the crime. So the consent is very important. Blank consent. There was there is the this one in the doctor that previous year 10 years back, the blank consent, when the patient get admitted, so his name and the signature, and that consent was that whatever you are going to do any operation, this all these things were there, but the blank consent is not legally accepted. You have to take consent of each and every procedure. Even if you want to do the venesection, there is the possibility of the risk. You have to take the consent of the venesection also. Afterwards, if you have to do the blood transfusion, there is risk of the hypersensitivity reaction. Again, you have to take the separate consent for the blood transfusion. For each and every procedure where you think there is risk to the patient, better to take the consent. Then, if illiterate patient is there, the thumb impression and the signature of some witness should be there. Each risky procedure, new separate consent I have already told. So, how the proper consent should be taken, the small video I will show it.
एक मिनिट हा. हॅलो हा बोल बोल. नाही उद्या स्क्रीन आहे, गुरुवारी आहे, APR गुरुवारी आहे. हो हां 5 मिनिट. अरे दोषाचं झालं काय इन्स्टॉल सगळं? हां ओके 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 मी करतो ना.
साहेब बसलेत बाहेर. परशुराम साहेब
बसलाय ना जागेवर.
तू कशी काय ओळखतेस यार?
सर कालच हॉस्पिटलमध्ये सिटी स्कॅनच्या इथे आमची ओळख झाली.
बरोबर.
सर
असं तू बस 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 बस.
नेक्स्ट.
किती पेशंट आहे? बरं पुढच्या 10 मिनिटात कोणालाही सोडू नको जात. हां बोल. हॅलो हां देशमुख बोला. उद्या 7 वाजता ना? हो या ना. हो रिपोर्ट घेऊन या. ओके ओके बोला. चहा घेणं पण
नाही नको.
घ्या मी पण घेणार. हां द्या अर्धा चहा पाठवा. परशुराम कुठे
आहे? बाहेर बसवलाय.
एकटा आहे का?
नाही बरोबर आहे, सुनेचा भाऊ आहे.
बरं ठीक आहे. हे बघा असं घाबरण्यासारखं काही नाही. आणि घाबरून काही होतं का? आपल्याला शांतपणे सगळ्याचा विचार करायचा. परिस्थिती थोडीशी अवघड.
ऑपरेशनच करावं लागेल ना?
हो हो ऑपरेशनच करायचं आपल्याला.
नंतर त्याला दिसेल ना?
सांगतो सगळं नीट समजून सांगतो मी तुम्हाला.
नाही ऑपरेशन करा तुम्ही, खर्चाची काय काळजी करू नका. झाडमुळे विकीन मी बघीन काय करायचं.
नाही प्रश्न पैशाचा नाहीये, त्याची काळजी करू नका तुम्ही. सांगतो ना तो प्रश्न नाही. या चहा घ्या.
राहू
हे बघा आपल्याला दोन्ही डोळ्यांचं ऑपरेशन करायला
पण दिसेल
नाही. आपल्याला परशुराम सगळ्यात महत्वाचा आहे की नाही? हो की नाही? मी सांगतो तुम्हाला समजून घ्यावं. हे आपले डोळे बाहेर बुबुळ असतात ते काय, त्याच्या मागे हा रेटायना असतो, त्याच्यामुळे आपल्याला दिसतं. या नर्व्ज असतात मागे, आणि ह्या जंक्शनला इथे त्याला कॅन्सर झालेला आहे. त्याला डोळ्याचा कॅन्सर म्हणतात. बाबा बाबा नीट हे बघा बघा माझ्याकडे बघा बाबा. हे बघा या दोन्ही डोळ्याच्या मुळाशी कॅन्सर झाल्यामुळे आपल्याला दोन्ही डोळ्याचं ऑपरेशन करायला लागेल. आणि आत्ता जर केलं तर आपल्याला उपयोग आहे, कारण पुढे हा कॅन्सर जर शरीरात पसरत गेला तर आपल्याला काही करता येणार नाही. म्हणूनच आपल्याला ऑपरेशनचा निर्णय लवकरात लवकर घ्यायचा.
बाबा तुम्ही थोडा चहा घ्या.
दुसरे डोळे बसवता येते.
नाही
एक बसवलं तरी चालेल.
अहो ह्या केसमध्ये ते शक्य नाही. ऑपरेशन तर करावंच लागेल लवकरात लवकर.
दुसरा काही उपाय नाही का?
मला सगळा विचार करूनच मी तुम्हाला निर्णय दिला आहे. आणि सुदैवाची गोष्ट म्हणजे हा कॅन्सर पहिल्या स्टेजचा आहे. जर ऑपरेशन केलं तर आपल्याला काही प्रॉब्लेम येणार नाही. इनफॅक्ट ऑपरेशन नंतर त्याच्या आयुष्यातला एकही सेकंद कमी होणार नाही, हे मी तुम्हाला सांगतो. पण वेळेस आपण ऑपरेशन केलं तर नाकात एखादी केस आहे दोन्ही डोळ्याच्या कॅन्सरची.
वर्षा सुद्धा लाखात एक.
बरं ऑपरेशनचा निर्णय तुम्हाला घ्यायचा आहे ना?
आता निर्णय काय घ्यायचा?
घरच्यांशी बोलून बघा.
आता करा ऑपरेशन ताबडतोब.
असं काही नाही, तुम्ही घरच्यांशी बोला आणि 2-3 दिवसांनी मला सांगा ना, काही प्रॉब्लेम नाही.
बाबा तुम्ही जरा शांत.
बाबा बाबा एक मिनिट. बाबा एक मिनिट. बसा बसा शांत बसा. हे बघा आणखीन एक महत्वाची गोष्ट ही लक्षात घ्या बाबा. हे बघा, कुठलंही ऑर्गन काढताना किंवा शरीरातला भाग काढताना पेशंटला पूर्वकल्पना द्यायला लागते.
हे माझं आता नाकात खाद्यावर टाकू माझं.
बाबा प्रयत्न करा ना, प्रयत्न करा.
तुम्ही सांगा.
नाही हे हा प्रयत्न तुमचा तुम्हालाच करायला पाहिजे.
पोरगं पदरात टाकलंय तुमच्या.
काही काळजी करू नका, ऑपरेशन नंतर काही प्रॉब्लेम येणार नाही. ओके, तुम्ही जाऊ शकता. केलं तरी चालेल, मला तुम्ही निर्णय कळवा प्लीज. मला
So before taking any consent, you have seen that all steps are taken. First and foremost, that environment should be the silent one. They have given the offer tea and all these things. I am not saying that every patient you offer the tea, but like this, some comfort should be there. Then they have told what is the diagnosis, and they also told, doctor has told the treatment part. Again, they said that the alternative is there or not. In the good consent, all these steps are there. So that thing. Then they also told that it's your family decision. Don't be in a hurry. Speak with, because the many illiterate patient tells that you are doctor, we are illiterate, we don't know, you take the decision, and in emotion also we take the decision. Afterwards some things go wrong. Then the many medical negligence cases are the responsible we are only, because with our this one both doctors another doctor tells that this doctor has given the wrong treatment. So the 80% Vijay Patel sir also agree that 80% negligence cases are due to the provoking of another doctor, because all these patients are illiterate, and they in India till date they also trust as we are next to God. So if any illegal any medical negligence occurs, you will be in this. So this he was a firm that no, I am not going to take onus. It's your family decision. You take the decision. After that only we are going to do the operation. So these are the steps. If I tell theoretically, but seeing the video, one picture is equal to see the that is the 1000 words speaks for the one picture. Then most of the about MCCD, there is the misnomer that we always see that we give the death certificate. We don't give the death certificate. So that remember, we give the MCCD. What is MCCD? That is the medical certificate of cause of death. And who gives the death certificate? Is the registrar of the birth and this. That Parkinson must have told you. So don't use the death certificate. As a medical practitioner, we give the MCCD. That is the medical cause of death. Again, birth and death register is done at the place of the occurrence. Means if the patient is of a Nagar, admitted at Pune and died at the Pune, this death should get registered at Pune, not in a Nagar. So the place of, or like that of the birth is same. Then after the death, expiry of the 21 days, but within 30 days of the occurrence shall be registered with the late fees. After 31 days of the, within 1 year shall be registered with the written permission by the officer. And after 1 year, you have to go to the court if you have not done the birth and registration, and from that judicial magistrate if orders, then this registration of the birth and death should be done. So this is the heart of the any MCCD, that A, B, C. C is the basic cause, C gives B, B gives A. For example, if the patient is suffering from hypertension, hypertension has given atherosclerosis, and due to the atherosclerosis, myocardial infarction. So A is the immediate cause of death. You have to also write the time interval, like the hypertension from 20 years, atherosclerosis after 10 years, and the MI was within 2 hours. Like that, the approximate interval, and you have to use the ICD codes. And the unique case of the death certificate, that it is the similar throughout the world. That is the form 4 and 4A. So that is the unique of the MCCD. Second, if you are going to give this certificate, physical fitness certificate, medical fitness certificate, you can charge, but for the MCCD, don't charge. So you don't charge to issue any MCCD, and should not withhold or issuance of the medical certificate even if your dues are not paid. You all know that if the medico-legal case, any case, patient is admitted in the ICU, bill is up 2 to 5 lakhs, and till the patient's relative the gives or pay the bills, till that body they detain. But it's a very wrong practice, and many quarrel or many mishaps occurred in a hospital due to this wrong practice. So think again, I am saying the empathetically. For the again money, if you are detaining body, it is the not again the humanity. So you will say, then how that we have spent 1 crore for the hospital, all these things, we have to pay the medical officer, nurses, and if everybody says that give the body without pay, how we run the hospital? There is the thing. First and foremost, if this situation occurs, there is one karyakarta, that is the one active person is there. So you should have that thing. You call him to your cabin, take him in a confidence, tell him that this is the 2 to 5 lakh bill. I have to run the hospital. I have to pay my employees. I have to also we have spent on the drugs and all these things. So I trust on you. Within 15 days you pay, and you are responsible for it. And many times 95% that person agrees, and you also win-win situation is there, that after 15 days you are going to get your bills, and there is no this one misunderstanding between the relatives and the you. And even if in 10% they don't listen at all, then what happens? You give the body, and afterwards you can go to the court, tell in a court, and from the court you can reimburse whatever you have spent. But don't be aggressive at that time. Loss is of yours only. So remember this. No medical officer should sign the medical certificate of cause of death in advance without viewing or examining. There are instances that they have declared the death, and in postmortem the patient has this one when you taking the incision. There are incidents. So before declaration of the death, be confirmed. Understood? So that care must be taken. When not to issue MCCD, the injured is broad dead. Crime has already been registered by the police. The police has already been informed. Means you have done the MLC. If you have done the MLC, then you should not give that body to the relative. Again I am saying, who is the owner of the dead body after the MLC? Is the police. Let the relatives go to the police. They have to decide. So you don't take the owners. So if the police thinks this one, they can hand over, but the police officer doesn't have the medical knowledge. Usually in 100% case, that case is the MLC, and after the postmortem only the body get hand over to the relative. In this also you can, as it is, there are some policies, some this one, if there is no proper MCCD, so whatever the policies are there, that they are not going to or get benefit to their son or daughter. In that thing, you can assure them that the medico-legal postmortem is necessary for the further benefit. The cause of death is unknown. In that case also, you have to do. There are three types of the postmortem. That is academic postmortem, that is done by the anatomy department in the first year. Second is the clinical postmortem. It is done by the pathology department. If the patient is admitted for 20 days, no MLC case, but the patient died, no cause of death. In that case, and it should be done in institute level, because we are going for the research. The internship, Dr. Srivastav sir is there, even the pathology department helps them. Only one thing is required, is that you have to take the consent of the relatives. If the relative gives the consent, then only you are able to do the clinical postmortem. Also, Shinde sir is also there. He is going to help to the medicine department if the Srivastav sir, for the academic purpose, the cause of death, so the clinical postmortem can be done, and the another is the medical legal postmortem that is done by our department, that is the forensic medicine department. In case of the unnatural death, body should be handed over to the police who hold the investigation, send the body for the postmortem examination. I already told, and again, this is my last slide. The last slide last video I am going to show that should change whatever your views is there, because all things is not for the money purpose. Be empathetic, otherwise you will earn the money, and one day will come that some mishap will occur and you will be the zero. I am not threatening or this thing, but if you remember or have that small thing in your mind that we have to do our practice ethically. Throughout your practice, if you are daily seeing 25 patients, it's okay. But this 25 patients will be the same. Your graph will be like that. Otherwise, the graph will be peak and again zero. So, and the postmortem, this is related to our department. If anyone does the MD forensic medicine, and you want to, or those who are the medical officers in government, medical officer has to do the postmortem examination, but sometimes all these things happens and that should not be done.
दारू कशाला पिणार नालाय का?
Sorry for the
पोस्टमार्टम करायला नंदूची केस वेगळी आहे, त्याने आत्महत्या केलेली असं सांगायला लागला जसं काय वर्ल्ड कप जिंकलाय त्याने तिथे. हे बघा साहेब, तुम्ही पोस्टमार्टम नाही केलं तर त्याच्या घरच्यांना सरकारी मदत नाही मिळणार आहे. सांगितलं ना 5,000 रुपये लागतील. अरे काय माणूस आहे का नाही? माणूस केलाय, जीव दिलाय त्यांनी. अरे म्हणूनच कमी सांगितलंय तुला. डॉक्टर डॉक्टरचा याच्यामध्ये संबंध असतो, काय बोलायचं ते मला बोला. साहेब मी हात जोडून विनंती करतो. काय एवढे पैसे नाही तर बॉडी घेऊन जा, पैशाशिवाय समज नाही बाबा. अरे पैसा पैसा करून मरशील भाडव्या. बायको सुद्धा जवळ झोपायचे पैसे मागल तुझ्या. बस आहे तुझ्या माईचा दलिंदर तुझ्या. साहेबांच्या पोराला आणायचंय शाळेत. ड्युटी करा ती ड्युटी वाईट आहे नसतं. साहेब पोस्टमार्टमला बी पैसे मागतात. अरे मग द्यावंच लागत असते. मग तशी जाहिरात द्या ना पेपरात. चिरफाडीला बी पैसे लागते. त्या धसक्याने शेतकरी आत्महत्या तरी नाहीत करायची. हे शांतपणा करतो का?
I think whatever I have told you, you will take seriously, and 10% my interns, 10% resident, you follow whatever I have told, whatever I have spent time here, it will be fruitful. I am again thankful to my dear friend Dr. Vijay Patil for calling me to give the session on this. I am thankful to management, Medical Director Dr. Abhijit Dute sir, Dean Dr. Sunil Natha Maske sir, Chief Administrative Officer Dr. Padalkar sir, all my respected teachers, HODs, Warren Madam, Kapade Madam, More sir, Naikwade sir, Deshpande sir, Vaidande sir, Shinde sir, my own department, Dr. Parkhe sir, Kamble sir, and my beloved student, and also Ansole sir. Thank you very much.